Erythrocyte sedimentation rate is a blood test related to hematology section of the lab. As the name shows, the rate at which red blood cells sediment or settle down. The test is usually recommended when you have weight loss, pain in different body regions, joint stiffness, anemia and headaches, etc. The purpose of the mentioned test is to note the rate or time period within which erythrocytes settle down in a specific ESR tube. Normally, red blood cells settle down one by one and takes a lot of time to sediment completely. But in case of an inflammation, they stick with other red blood cells present in the blood and settle down at faster rate rather than normal. So ESR levels faster than 0 to 15 mm per hour in male and 0 to 20 mm per hour in female indicate the presence of an inflammation in the human body, which is the natural defense mechanism against foreign harmful stimuli. Estimation of ESR is usually done through Vestigian tube method and Winthrop tube method. Here we will have discussion about Winthrop method. We may have following some requirements for this method, which includes Winthrop tube strand, Pasteur pipette, stopwatch and sodium citrate blood sample. After mixing an anticoagulated blood properly, fill the Winthrop tube with Pasteur pipette up to mark 0. Then place that tube in Winthrop stand vertically, and after about an hour, note the time erythrocytes took to sediment.